Osteopathic manipulative therapy that we offer in our outpatient setting has been driven by our residents. We have a large amount of residents that come from local and really all over the country osteopathic schools. We want them to be able to continue their training and be able to hone their skills in this style of medicine. And we've done so by creating a room that has an osteopathic table. We have an osteopathic medicine interest group, and we have opportunities for them to not only care for their own patients, but for maybe their allopathic partners to refer patients to them for osteopathic therapy.
I'm Carly Chapman. I'm a resident of Ball Memorial Hospital, and I'm also a DO. I graduated from Marian University, and I chose Ball Memorial Hospital because the program here has allowed me to use my osteopathic skills as much as I have wanted to, and I love OMM, and so I get to use it a lot. And I schedule my patients that come and see me, I can schedule them into my clinic, which is really nice for continuity purposes. So I can see, hypertension in the same day that I see an OMT patient. And it allows me to kind of practice my skills on a weekly basis, which is really nice. And they support me here, and so we have great faculty that I can go to if I have questions about OMT, and also co-residents who are doing OMT as well. Another way that they support me, which I was really excited about, is that you can use your CME money to do the osteopathic convention, which I love. And if you guys do like OMM, like I like OMM, then you probably know about the AAO convocation, which is like a yearly convocation that they have. And all the big DOs come in and you just do OMT for a week, and it's fantastic. So you can use your CME money to go there. And so I chose Ball because they supported my vision for OMT, and they continue to support my vision for OMT and support me using it in the clinic.
As point-of-care ultrasound has emerged as something that family doctors are doing more and more of over the past several years, we found it important to incorporate it into our training. So what we have done here is really create several opportunities for residents to get involved with point-of-care ultrasound and get more comfortable with it. So we've done things like incorporated a simulator through SonoSim, where they will go through a series of different learning opportunities to get comfortable in a more controlled setting. And then we have ultrasounds in the outpatient setting and an inpatient setting that they can use to go and become comfortable with those procedures at that point of care. And so the AAFP has designed a curriculum that allows for them to go through a series of yes and no type scenarios of things that they can accomplish with a patient and do so comfortably. Things like position of a baby's head. Is there stones in a gallbladder? Is there a normal ejection fraction of a heart? So very simple yes and no type questions that will allow them the opportunity that in that point of care, just like we've used the stethoscope for many, many years, and say I can use an ultrasound to guide my clinical decision capability. And that is the goal of point-of-care ultrasound at our residency, is to be comfortable with answering many yes-no questions that are easily definable with an ultrasound with minimal amount of training for them to use in their practice once they graduate. We are lucky enough to have a wide variety of sports medicine opportunities. We're lucky enough to be in a rural setting, but have a Division I university local, and have many high schools that have opportunities and actually want our residents to be participating in sideline medicine. We have some graduates of our program who have completed sports medicine fellowships who work within the community and work with our residents to help them obtain those skills. We'll be able to get them the experience with ultrasound guided injections. We'll be able to get the experience with sideline medicine, where when they show up at those fellowships, they're already well on their way towards the training that they need. And we've had feedback from many of our graduates that have gone on to fellowship that said that they felt well prepared for that fellowship.